So we'll be palpating the joint line and meniscal window as well as the tibial plateau. First, you'll want to find the patella tendon and move your thumbs medially and laterally and posteriorly. From here, this depression will be the joint line and meniscal window. If you continue to palpate inferiorly, you'll find both the medially and the lateral tibial plateau.
Inferior to the patella, you'll find the patellar tendon. If you follow this distally, it will insert into the tibial tubercle. From medially and posteriorly to the tibial tubercle, you'll find the pes anserine, which can best be felt when the patient is resisting flexion. You'll feel a small indentation.
Okay, we're going to be palpating the medial femoral condyle and the medial femoral epicondyle. We start with our patient with their knees flexed to 90 degrees. We're going to get our thumbs in the meniscal windows at the joint line. We're going to push up and medially, and while staying in the joint line, we'll be able to feel the medial femoral condyle. If we continue to push medially on the patella and stay in the joint line, we're going to feel the medial femoral epicondyle.
We'll be palpating the adductor tubercle. First, you want to find the medial femoral condyle located here and move medially inward until you find a bony prominence at the end of the natural depression. All right, we'll be palpating the medial meniscus. First, you want to find the medial joint line here, and then internally rotate the tibia, and you should be able to palpate the anterior portion of the medial meniscus.
We'll be palpating the medial collateral ligament. Usually this ligament is not palpable unless symptomatic. However, when you are palpating, you will locate the medial collateral ligament in the medial joint line within the medial meniscal window right here. And what you want to do is palpate medially and posteriorly. And that is where the MCL ligament would be located.
We'll be palpating the lateral tubercle. First, you'll want to find the patella tendon located here and move laterally, and it should be right here.
Now we'll be palpating the lateral femoral condyle and the lateral femoral epicondyle. We're going to go just distal and lateral to the patella. And as you're going lateral, you'll feel the smooth area of the lateral femoral condyle. If you continue to go laterally, you'll be on the lateral femoral epicondyle.
Now we'll be palpating the head of the fibula and the common peroneal nerve. The head of the fibula can be located by starting at the lateral femoral epicondyle, right here, and moving your fingers inferiorly and posteriorly to this bony prominence. This right here is the head of the fibula. Running distally along the fibula's neck, you can find the common peroneal nerve.
We'll be palpating the lateral meniscus. First, you want to find the lateral joint line and palpate. You want to have the knees slightly flexed so that you can feel the anterior margin of the lateral meniscus. So we'll be palpating the LCL. First, you want to have your patient's legs crossed so you can have easier access to the LCL. You want to palpate the lateral epicondyle and move down to the fibular head, and in between these two structures will be the LCL.
We'll be palpating the biceps femoris tendon. The biceps femoris tendon runs laterally alongside the knee, comes down, and inserts onto the head of the fibula, right here. This can also best be felt when the patient resists knee flexion, like so. We'll be palpating the iliotibial tract band. This can be located anteriorly and laterally alongside the leg, like so. This can best be felt one of two ways. The first way, you can have the patient dig their heel into the ground. You'll feel it's more prominent. The other way is simply to have the patient extend their leg. Either way, the IT band should be palpable.
This is the patella, also known as the kneecap. It's the large sesamoid bone that lies anterior to the knee joint line. Beneath it, by moving the patella laterally or medially, we can palpate the trochlear groove.
The quadriceps tendon runs from the end of the quadriceps muscle to the superior pole of the patella. The quadriceps tendon encompasses the patella. The patella tendon is from the inferior pole of the patella and inserts on the bony prominence of the tibia, known as the tibial tuberosity.